Welcome to a new episode of Amref Health Africa's in Kenya's podcast, Amref World Tobacco Day Special, Strategies for a Tobacco-Free Kenya with PS Mary Muthoni. I'm your host, Halima Sabwa. Today, we're delving into the pressing issues of tobacco use and its impact on public health in Kenya. We are honored to have PS Mary Muthoni from the Ministry of Health and Gilbert Wangalwa, Deputy Country Director of Amref Health Africa in Kenya with us today. Our discussion will focus on the current state of tobacco use, key policies in place, challenges, and collaborative efforts within this space. Now, to begin with a light-hearted question, PS Muthoni, what's your favorite way to unwind after a long day in public health?
I chill at home and stay with my family.
Okay, that's a really good way.
I think that is a very favorite way of spending time.
Okay.
Because after a long day, you've served the nation, you've served everybody else.
Yeah.
You need to go back home and serve yourself and your family.
Yeah, and also have some time to unwind from a really stressful day.
Absolutely.
Yeah.
And it gives me calmness.
Yeah. Definitely. And with talking about family and unwinding, Gilbert, what's the most unusual or unexpected item you have in your work bag?
I read.
Mm-hmm.
I always carry something to read.
Okay.
The unusual part of it is that strange ideas emerge in strange places. Therefore, I have to have some notepad to take note. Yeah.
And I'm sure it also helps unwind during a stressful meeting, which is really good.
Oh, yes.
Yeah. Excellent. And as we're talking about tobacco and tobacco use and the situation in Kenya, Gilbert, would you like to begin with an overview of the tobacco situation in Kenya? And can you share some insights on the current state of tobacco use and its impact on public health?
Yes, thanks, Halima, for that question. Tobacco pandemic is one of the greatest public health threats globally. Even before I dwell down to Kenya, globally. And for many years, we have seen increasing use of tobacco with its devastating effect on public health. According to WHO data that we have currently, is around 8 million people die due to tobacco-related deaths. And most 80% of those deaths are happening in low and middle income countries. So as we discuss this conversation, heading to the commemorating the World No Tobacco Day, it is a moment for us just to reflect that impact that tobacco has had, especially a generation, the young generation in the country, especially between 13 to 15 years. This is a generation that is now being enrolled into the use of tobacco. The devastating effect, the burden of tobacco on non-communicable diseases like cancers, stillbirths, low birth weights. We are seeing that evidence shows that all these deaths are associated with tobacco use. And all hospital admission, around 50% of hospital admissions are associated with non-communicable diseases, which greatly are contributed to tobacco use. Thanks.
And I really like what you called it, a tobacco pandemic. And it really shows that we do need more done in the space of cessating the use of tobacco in Kenya. And from that perspective, PS Muthoni, from the Ministry of Health, what key policies are in place to address tobacco use in Kenya?
Thank you very much for that question. And indeed, tobacco is a very devastating issue in Kenya today, and especially when we have the novel products that are upcoming. Items or products that we are not even conversant with. They are in different shapes and sizes, and you're likely to confuse it even with something really nice like a pen, a pencil, a rubber, a container to take water, So from the Ministry of Health, we have been able to pass legislation around tobacco, and going by the Tobacco Control Act of 2007 that prohibits people to smoke in public. Even in public places, we are supposed to have specific designated areas, smoke areas, so that we do not mix up with every other public space. You're not supposed to smoke in matatus. You're not supposed to smoke in markets, open area markets, but a specific designated area. Even in restaurants and bars, there is a designated area where someone is supposed to smoke. And of course, we have a comprehensive ban on tobacco advertising, promotion, and sponsorship. You will not see a tobacco company sponsoring or advocating for another product and putting their logo. We cannot see an advert promoting tobacco products, either on TV, on social media, or any other. That is illegal in Kenya. And equally, issues to do with the sponsorship of maybe an event. You cannot see a tobacco company that is sponsoring an event. Then we also have a lot of public awareness. Education is power. We go all out to educate the masses to ensure that they get to know the dark side of the tobacco product. And consumption of the same can lead to serious disease burden to self and family. We have seen even many cancers today are being brought about because of the smoking and nicotine products. Therefore, it would be important to educate the masses every now and then. Then we equally have the graphic health warnings, and we have made it mandatory that every product, tobacco product, must have the health warnings that are aligned to the Tobacco Control Act. And that is what we are emphasizing, whether it is a new product or old product, they must align with the health graphic warnings of the tobacco control product. We equally are moving in terms of education, encouraging the masses to have an alternative way of livelihood, of earning economic, introducing other ways of other crops. Instead of planting tobacco, it would be important to probably plant beans, and we have seen this with the help of development partners or partnerships. In Migori, we have assisted about 5,000 farmers who have been able to change from tobacco growing to subsistent crop growing.
Okay. And I really like what you talked about, novel products and how children are being enticed to smoking tobacco in different forms. That being said, when we're talking about tobacco products, PS Muthoni, shisha has been a challenge among youth in Kenya. And in the recent past, there has been a ban on it. But is that still being enforced? And how best can we address the shisha challenge in Kenya?
The ban on shisha is still enforced in Kenya, and to address the challenge effectively, a continued multi-agency approach is required. Multi-agency approach between the players, maybe the Ministry of Interior for enforcement, administration, NACADA, the owners of restaurants. It is important to all come together so that we are able to enforce this. And until then, when the country probably has a different opinion around it, shisha remains banned. Then also we have enhanced public awareness about shisha. Then equally collaboration with stakeholders, development partners and others like Amref for robust monitoring and evaluation enforcement, which is very essential as we look towards ensuring that the ban is effective.
And you are right, multi-agency approach through collaborative efforts is paramount. And that being said, Gilbert, considering Amref Health Africa's focus on non-communicable diseases as part of our strategic areas, how does the organization support tobacco cessation indirectly through the non-communicable diseases initiative?
Great. As Amref, we've a big bet around non-communicable diseases. This is efforts to reduce premature deaths associated with non-communicable diseases. And for us to be able to come up with an approach that is all-inclusive is how to integrate non-communicable diseases into other health programs, anchoring into the primary health care, especially now that the government has really embraced the primary health care and we have community health promoters across all the country. How can they be the frontline agents in creating awareness among the household members on the risk factors of tobacco use? That is one pillar. Number two, we also look at surveillance. How do we use the power of data to be able to identify the cases, especially the new users of tobacco, how they use the new trends that the PS has basically been able to mention, and the impact of tobacco cases to the health of the population. So we are looking at that at two fronts, integrating it within the primary health interventions that we do. And number two is basically embracing data, just to crunch the data to understand the trends for us to be able to inform policymakers in regards to coming up with evidence-based interventions to address the non-communicable diseases associated with the tobacco use.
That's great, because we need data to inform policy, and based on that, and especially through multi-agency approaches. And PS Muthoni, as we were talking about multi-agency approaches and collaborative efforts, how do you feel like the Ministry of Health can collaborate with organizations like Amref Health Africa to strengthen the fight against tobacco use, particularly in addressing non-communicable diseases?
I don't just feel how we can, but we are already doing it. And one of the key areas we are collaborating with even Amref is implementing the tobacco control programs. We are now looking at tobacco celebrations on the 31st of May, and I am sure Amref is going to be part and parcel of the same. It's a 1 week celebration where we will start with even tree planting, engagement with the counties across the country, ensuring that we do cleanup exercises, health education and promotion to the affected areas. And we are doing it right in Mombasa. And in Mombasa how we have a challenge in terms of drugs and substance use. Then also conducting of research. I know director has talked about numbers, and really we may not do much without numbers. We can't do much. We can't plan better if we are not able to keep getting the numbers from the bottom of the pyramid. Therefore, collaborating with the stakeholders to ensure that we are conducting assessments every time, research and effects of tobacco from the people who are taking. Then capacity building and training is one critical area, and especially for the staff. We have the Division for Drug and Substance Use in the ministry, specifically for that work. And many a times we keep doing capacity building on the same to also get aware of the changing times, the dynamism around the tobacco industry. And this helps our teams to also be able to approach better, and also coordinated training and capacity building within our partners and the ministry. Equally, raising awareness together, like what we are doing is raising awareness. We are in partnership. This podcast is between myself and Amref, so it's a collaborative effort to ensure that we are speaking in one voice. And when we speak, we send a specific message targeted to the masses. Then we have community outreach programs and partners partnering to deliver anti-tobacco messages to the communities. It's similar to what I have just said. We can do radio shows together. We can write pieces in the newspaper together. We can produce magazines together, that are targeted to the masses. Therefore, a partnership is very key, and you cannot walk it alone, because this is a pandemic, as Director said, that is affecting everybody, either directly or indirectly. And more so, the biggest piece of it is indirectly. And it would be important to say that if you have an addict in your home, then it affects the whole family. Because should there be, should he contract any disease, then it goes back to our coffers to try and treat this person. If it is an issue of addiction, rehabilitate this person if it is in terms of addiction. Therefore, partnership is very, very key. And I have also mentioned that we have been able to change lives in Migori County, whereby tobacco growers have changed to growing subsistence crops that are going to be good for their nutrients. It actually puts us in a level where we reduce malnutrition in children, malnutrition in ourselves, and equally have a balanced diet. Thank you.
As you had said, in Migori County, there are 5,000 subsistence farmers that have changed from using tobacco as farming tobacco. And as we conclude today's informative episode on Amref World Tobacco Day, I would like to express my heartfelt appreciation to PS Mary Muthoni for making time with your busy schedule. And also I'd like to appreciate Gilbert Wangalwa, the Deputy Country Director of Amref Health Africa in Kenya. And our discussions have spotlighted the necessity of governance and strategic partnership in the fight against tobacco use in Kenya. Their insights have empathized the need for synergy between policy, implementation, and community engagement to steer us towards a future where tobacco is significantly reduced, improving health outcomes for all Kenyans. If you have any questions, queries, or concerns, you can connect us at Twitter, which is Amref_Kenya, Facebook at AmrefKE, and Instagram, which is #AmrefKenya. I've been your host, Halima, and goodbye for now.